Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Islanders. We hope you enjoy this edition.
Hi, you're watching Labor Vision, the at-home edition. I'm your new host, Autumn Guillotte, and continuing with our series on ARPA spending in Rhode Island is Paul Valletta from the Rhode Island Association of Firefighters. Just to do a little bit of background, the American Rescue Plan Act, or ARPA, was signed into law on March 11th in 2021 by President Biden. This act is a way for the federal government to aid state and municipal governments coping with the fallout from COVID-19. Rhode Island's share of these dollars includes $1.13 billion of state fiscal relief, $540 million for local fiscal relief, and $415 million for relief for K-12 schools. On August 4th, 2021, the Rhode Island AFL-CIO convened a gathering of labor leaders from across the state to discuss how the state could best deploy these funds to help working class Rhode Islanders. Based off these discussions, several recommendations were made, including 6 key proposals to help support our first responders. So here with me to talk about that is Paul. Hi, Paul. Thanks for being here.
Thank you for having me.
Of course. So we have a couple of recommendations that come from first responders, and you're speaking on behalf of the firefighters. But before we go into those, I wanted to talk a little bit about what your membership's experience was like in March 2020.
Sure. Well, it was a challenge for us, just like it was a challenge for everybody else. We'd been, pandemics and infectious disease is part of our job. We've always known that, and we've trained for these things, hoping we would never actually have to take part in them. But it was trying on the basis of it lasted so long, and at the height of COVID, we were doing probably 12 to 15 COVID runs a day. And the problem with that was that when a rescue did these COVID runs, you got a call that someone had COVID symptoms, would take that rescue out of service for 2.5, 3 hours, because we'd have to transport the patient, and then we'd have to completely clean the trucks out, wash them down inside. We ran into a problem with PPE. And most of the departments, a lot of the departments put on strictly a COVID rescue, which, they try to put plastic in the back of the truck. So, to keep it clean, but you'd still have to clean it after every run. We started running out of masks. We started running out of the paper coveralls we put over our uniforms. And that was a big issue for us, PPE. We had never, sometimes we don't agree with all our mayors and our town managers. We have disagreements at times, but I can tell you that none of them have ever really skimped or gave us any trouble when it came to PPE. And we got to the point where we were wearing masks that were supposed to be used for one time. We were wearing them for a week, which just isn't healthy to do that. We ran out of our coveralls, to the paper coveralls to put over our uniforms. So every time the firefighters had a COVID run, they'd have to go back to the station, bag their uniforms. We started running out of uniforms. So then we went to a different tack that we very rarely use, because our rescues were so busy during COVID. Most of our engine and ladders would get to the house first, and we'd have to change up where the whole crew would go inside to assess the patient, where just the officer of the truck would go in, because we just ran out of PPE. We didn't have enough to send everybody into the house. If we got to the house and it was a serious case, then the whole crew would have to go in, of course. But we initially sent one firefighter in to evaluate the patient, and it was just, minor symptoms at that point. We'd wait for the rescue to get there. So the PPE was a real big thing with us. We had to put in place protocols for when you got back to the station, because firefighters live together, they sleep together, we're in the same bunk room, we're in the same day room. We're just like, when we say we're a family, that's the way it is at the firehouse. The firehouse is like your regular house. Like when one person in your house gets the flu or the cold, it's probably going to go through everybody. And that's what we really had to try to mitigate with COVID, because I mean, we did a great job. The men and women did a great job, but we did have a few departments where a whole shift had to go into lockdown. And these were the things we had to worry about. Probably the biggest thing I think that was different for my members this time, and those things we can all, you know, we wore our masks longer than we had to. We got by with the PPE. But I think the biggest thing about this pandemic, and as we continue, is something that's never happened in the fire service. We were bringing this home to our families because firefighters did get sick. We had quite a few firefighters come down with COVID. I mean, it's just, you got to realize, even using the PPE that we had, we're going into the house where maybe 2 or 3 people have COVID. So we're actually walking into the atmosphere of where this is. Our rescue guys are sitting in the back of a rescue truck that isn't that big, and they're sitting, you know, like 2 feet from the person with COVID. So we did have COVID cases, although we tried to mitigate it. We did have COVID cases. And I think that was the biggest thing. We had guys take it home to their families, and their whole family got sick from it. And so that was a big difference for us. And then we worked with some, which wasn't good, you know, site-wise. What we accomplished is that we got a few hotels to open up to firefighters, and guys weren't going home after that. And that's not conducive to our health. You know, you want to see your families in that. And just think of the spouses of our firefighters at the time, where your husband or your wife is at work, and then when the day's over, they're not coming home. They're gonna go sit in a hotel. So that really put a lot of strain on us for a while. But we got through it, and you know, of course, my men and women stayed at their posts like they always do. And those were some of the things, some of the big things we were dealing with.
Yeah, I mean, that I can't even imagine, right? I think firefighters especially are used to accepting a certain amount of risk about the work that they do, but then having that added element of bringing it back to your family, I think that had to have been very scary for your membership.
Yeah, it was. It was. You know, like I said, the only alternative was you don't go home, and that's not good. But we had, you know, it got to the point where we had firefighters doing that because they just didn't want to take it home to their families anymore. I can't blame them. But yeah, that was probably the more trying, because we try to, being firefighters, we try and control the risk. And even though we put all these protocols in place to protect us, you just weren't going to protect everybody. So that was the biggest thing, I think.
So it's hard to think of firefighters as anything other than essential workers, right? You're always on the front line, regardless of whether or not there's a pandemic going on. Some of the other things they believe that you all were doing weren't you there during COVID vaccine administrations and testing, right? You were also at those facilities, yeah. Right.
Yeah, we started. Not only were we doing the COVID runs, but when we finally got the vaccine, we called up. I know when they thought they were getting the vaccines in early December, when it was said that it was going to be coming out at the end of December, we called the administration. We called the state administration, and we said, "Listen, we've got firefighters who give shots every day on the rescue trucks, and let us know if we can be of any help." So we got the call, a few weeks later, and we set up a lot of the first municipal. We were the ones giving the shots, the first municipal pods, and we've told them, and we've started booster clinics also now. And then we were able to, through the federal government, get the 15-minute by accident test, the quick test, and we started doing those also. And we were doing the PCRs. So yeah, we've been, not only were we doing the runs like we always do, but yeah, we were I think we were instrumental in the first municipal pods that were set up that worked really well. And it was more like the big state ones, the ones they had at the Dunkin' Donuts Center and things like that. They that was good, they worked, but these municipal pods really work because, especially with the elderly people. I know in Cranston we were using the senior center to do the vaccinations. People, especially Rhode Islanders, they like staying in their own town, in their own city. They don't like going to these, the Dunkin' Donuts Center. It gives them this stress and anxiety. So especially our elderly people, they were nervous about the vaccine to begin with. And if you tell them, well, you can go to the senior center in Cranston where you live, it reduced their stress level. So yeah, we were glad to be part of that, and we still are part of it, given the vaccinations and the boosters. So yeah, we were very instrumental in that too.
Well, cool. So I want to get into the recommendations that came through, Labor's recommendations specifically that cover our first responders. There's 6 of them. So just to kind of go over them roughly, the first is that the state should reimburse municipalities for local funds spent on the fire service over time during the pandemic for PPE expenses. The second is that the state should pay for UV light systems for every full-time fire department in the state, while also building a stockpile for PPE, including UV lights and hazmat suits, accessible to all first responders. The third, the state should purchase for each Rhode Island firefighter a personal respirator with at least 2 spare air cartridges. That one is particularly interesting. I remember you speaking about that during the Senate Finance Committee meeting a couple of weeks ago, on what that could mean for your members. Do you want to elaborate on that a little bit?
Yeah, so this is something we probably couldn't do if we didn't have this money available. It's probably something we wouldn't do if we didn't have this money available. But I just see it as an opportunity. So we all know how hot it was to get N95 masks when the pandemic hit. There was price gouging. Usually they cost less than $1 if it was normal times. N95 masks were going for $10, $15 a piece, which is, in the middle of a pandemic, people that were doing that. Wow. It's just egregious to do something like that, to take advantage of a pandemic. But it was happening. And I got to tell you, when we did find them, the cities and towns, even though the prices were astronomical, they never gave us any trouble. We were fortunate that we didn't have to go to that $10, $15 range. We were fortunate that we found a company for $1.10. So, and that's when we were able to get a big order in and disperse them to our firefighters, and we included other unions that needed them. But this respirator issue, so this company, MSA, which makes respirators, they just came out with this new respirator, and it's strictly for COVID. It's not the paper mask that with paper respirator we normally wear. It's a plastic respirator that covers half your face, so the whole face isn't covered. And there's 2 issues for that. So we all have, every firefighter, when you get on the fire department, you're given your own breathing mask. And that's yours. Nobody uses it. You're the only one that uses it. You take care of it. You keep it in a bag on the truck, and that's yours. You use it.
You cut out for a little bit, so I just want to say that again. So each firefighter already gets their own breathing mask, right?
Gets their own breathing mask, correct. But that's the one we use when we go into fires. That's the full face piece, right? That hooks up to our tanks. It was suggested early on that maybe that's what we should be using. Maybe we should go in it. Maybe we should be going into the house with the tanks with the full masks. We took the stand. First of all, you can't hear in those masks. So if we're trying to communicate with a patient, you really can't hear what we're saying. Second of all, you walk into an elderly person's house who's already sick and who's already stressed out, who's already scared. They don't want to see, 4 firefighters walking in with full face piece on their mask,
Right.
on their face. So it just wouldn't have worked. Those things are bulky and they just wouldn't have worked. So we were using the N95. But when these new respirators came out, these fast half-face respirators, they're by cartridges. You use them with cartridges. And it's 100% protection for the firefighters. Now, between 100% and 95%, some would say, well, it's only 5%. That 5% could matter whether we get COVID or not. So, and the other part of this respirator was the N95 respirator. It protects the person with the mask on. It doesn't protect the patient that we're breathing out in the area. So
Right.
this new mask is 100%. It protects the person wearing it, and it because of the cartridges, what we're breathing out near the patient never comes out. It gets caught in cartridges. So it protects the patient also, protects the people that are around the patient. So that's what we're looking at. That's why these respirators would be so important to us, that we wouldn't even have to use N95s. We probably would get a bunch of them, and maybe they'd be used by the outside crew that didn't go in the house. But these masks would certainly be a game changer for the firefighters. And as I'm talking to this MSA person, as I've been talking with them, they have another mask that is a few dollars more that I'm going to try and put in for. That would have interchangeable cartridges. You'd have a COVID cartridge, and then you'd have a chemical cartridge that would protect you from a chemical spill. And I think if we're able to get the money, I think we should include the police departments too. If we're going to get them, our police certainly go on rescue runs with us. They're certainly on chemical spills and chemical runs with us to direct traffic, and they're not in the hot zone, but they're in the cold zone, and maybe they.
Right.
But these masks would be a big game changer. Everybody would get their own when they get on the job. That's yours. In our proposal, we put in extras for the municipalities to get extra masks for new people that come on the job. So that's why the respirators would be the big thing for us. It really would be.
Now there's a couple of more on the recommendations list. You also provide that the state should purchase a new rescue vehicle for each of Rhode Island's full-time fire departments, that the state should purchase or repurpose an existing facility to serve as a permanent location for a pandemic field hospital, specifically for COVID surges for now and the future. And then the last recommendation is that the state should improve all state-owned and publicly accessible facilities to account for social distancing requirements between members and the public, while reorganizing workspaces to ensure the proper social distancing can be done between the actual workers. What I really love about this is that these recommendations are very forward-thinking, that we're not treating this past year or so as an anomaly, but we're making sure that we can't be caught off guard again.
Yeah, listen, unfortunately, it's happening now.
Yeah.
Hopefully this new variant isn't, the vaccines are going to take care of it. But we know this is going to happen again. This isn't a one-time thing. And I just think this is such an opportunity. We should never have firefighters or anybody else. When I'm talking about firefighters, there's a lot of the hospitals that have PPE. So it just wasn't the firefighters, the people that we now deem essential workers that we never considered essential workers. My men and women have always been considered essential workers, and they are essential workers. But we never considered grocery workers as essential workers. We just, we never thought about teachers as essential workers, or we always should have. They get our children 6.5 hours a day, 5 days a week. But, you're going to think of that. But, I always, people don't mention the teachers because they did stuff by the Zoom, right? But they bought into that. And I had my granddaughter during that time. It was so hard watching the teacher. It's like herding cats trying to keep
I know.
It was
My mom,
unbelievable.
my mom's a teacher. She turned my bedroom into her remote classroom.
Yeah, it's unbelievable what they did. And I said this in committee, just think though, if the teachers didn't buy into that, right? And they didn't do what they, our kids would have maybe lost, they all would have been lost a year, maybe 2 years of their graduation date. They'd all be pushed back. So, kudos to them. And I mentioned this again at the Senate hearing. And I called them the angels, the nurses and the CNAs of our nursing homes, what they were doing. I mean, they knew they were going to work in an atmosphere that had one of the highest rates of COVID. But they were the only things because the families couldn't get in. They were the only people that were taking care of our elderly, and they did it. So, yeah, we weren't the only ones that went through this, but I don't think because we have this and because Rhode Island's small, we can pull this off. Like if we were talking about a California, you just never have enough money to do what you're going to do. But I think because Rhode Island, how small they are, I think we got an opportunity to put in place a PPE stash pile that we never had. No one ever has to wear a mask that's supposed to be thrown away after one use. No one ever has to wear it again for a week or 2 weeks. No one ever has to wear garbage bags on because they don't have anything to cover their uniforms. It's just we have a golden opportunity here
Totally.
to really take care of this. And so the other thing we were looking at is because it was so important to keep us getting COVID, and for 2 reasons. We don't want to get sick, obviously, and bring it home to our families. But imagine the compounded problem of COVID when it was at its height. If people were told, hey, listen, your fire department lost 2 shifts and they don't have enough people to come in, you're going to have to wait 15, 20 minutes, 25 minutes for a rescue from another city to come in.
Yeah.
So that would just compound people's stress if they knew their firefighters weren't there to, to come and help them in a medical or fire emergency. So we want to purchase these lights. They're $4,000 a piece.
The UV light, right?
Yes, they're air and surface disinfectant lamps. We hang them in the rescue, the departments that have them. That's how they sanitize their rescues. So after every COVID run, the guys and the women, they'd have to change if they didn't have a coverall, they'd have to decontaminate themselves. Then they'd have to decontaminate the rescue. Rescue was out of service 2.5 to 3 hours with the transport and the decontamination. With this light, right after the COVID run, the truck can go right back to the station. If the firefighters have the proper PPE, where they can put the disposable coveralls on with their respirator, it would only be the 2 firefighters in the truck, and that's what we tried to limit during COVID. We tried to limit how many people got exposed. But if we go to a COVID run, so now we go to a COVID run, we don't have the proper PPE, the transport, taking care of the patient, the transport, dropping them off at the hospital, going back to the station, decontaminating the truck, used to take 2.5 to 3 hours. That truck's out of service. With these lights, what we can do is with the proper PPE, firefighters go to the call, they have their respirator, they have their disposable coveralls. Right after the run's over, they drive back to the station, they clean the respirator, they throw their coveralls away, and they put this UV light in the back of the rescue for 20 minutes, takes 20 minutes, and then that truck's back in service. Big difference. And I think that's an investment we should make. The good thing about these lamps is they're portable. So they just don't go in the rescue. You could take them in the kitchen, you could take them in the bunk room. So for the small departments that only have 1, 2, maybe 3 stations, they get 1 light. Maybe the departments that have the bigger, like Providence, Warwick, Cranston, they get 2 lights. You can disinfect every station every day. You just send someone around to the city with the light, 20 minutes in the room, and it's disinfected. And I think that's what we have to. No one ever thought about that. I never thought about that we need air surface disinfectant lights in the fire station. That's where we are now. That's the new law. That's the new world we live in.
Well, I think that this is such a comprehensive list. It affects all first responders, right? Not just firefighters. This can go and be used across the board for all first responders. One of my other favorite recommendations that we've put forward impacts your workers, but also the people that your workers service. And it's our top recommendation, which is to say thank you to our workers during the pandemic by providing hazard pay for all essential workers that didn't receive this kind of hazard pay during the pandemic. And I think that would make such a huge difference, as you were talking about before, acknowledging how our shop clerks and grocery workers and sanitation workers and all of these are hospital care workers who sometimes earn minimum wage, right? We're working
Yeah.
right on the front lines of things to get them a little bit of at least a financial thank you for seeing us through this pandemic and supporting our society.
I think that's one of the most important ones. And like I said before, my men and women have always been considered essential workers. So I'm not, I don't say this is near and dear to my heart for that reason. I say that's because of the people that stayed at work. And listen, if I'm glad people could stay home, be safe with their families. I'm glad that happened. But you also have to look at the people that couldn't stay home, or more importantly, didn't stay home. Because I'm sure there are some of those grocery workers that could have stayed home and collected, but they didn't. They went to work. And I look at how stressful this was on people. And we're still in the middle of it. I mean, it's not over yet, but we're talking 2 years now. No one ever thought this thing would be going on for 2 years. And you see, like, you read the stories about suicides up, depression is up. Well, of course, you were locked down for 2 years. People's lives changed. But can people imagine what it would have been like if you couldn't go to the grocery store because there was nobody there to work? If the nursing home people said, no, I'm not going to work. What do you do if you have an elderly person, an elderly family member inside? There were so many people that kept state government open and municipal government open because people's lives still had to go on. They still had to get, they still had to do something with their government. The state workers, the municipal workers that stayed at work. Our construction workers who kept the infrastructure going. We see all the work going on in the state of Rhode Island. Imagine if that just stopped for 2 years. And again, our teachers, I already talked about how wonderful I thought. But yeah, I completely agree that these workers should get something just to say thank you. Listen, it's not, is it going to make a big impact on their life financially? Of course it's not. What's a couple of thousand, if that's what it is, going to make an impact on somebody's life? But it's just a way to say thank you. We appreciate what you did. And I just think if those people didn't do what they did, just the added stress of this whole pandemic would have been multiplied by 100. I just really, I believe that. And so, yeah, I completely agree that they should use some of this money. And it's not, wouldn't be something that's new. It's being done all over the country. This money being used to say thank you to workers. And there's just so much there. And I understand there's with it being $1 billion, they've already got 25 billion in requests. I understand that. There's this boatload of money, and we've had a lot of issues that a lot of people need help. I understand that. But I do think, and I don't begrudge anybody asking for money. And like I said, there's been programs that should have been funded that we just didn't have the money to do it. And maybe we have some money to help people now, and that's all well and good. But it really is money that we got because of the pandemic.
Right.
And you really should spend a good amount on it, on actual pandemic stuff. And I think the
Totally.
number one thing, these people, when you talk about this pandemic, the number one thing, and I, ahead of my stuff also, I'm not saying I'm putting these essential workers. I think this is the most important proposal we've made. These people should be thanked and given something. I truly believe that.
Well, I, I think that's a perfect place to wrap up. That's exactly what we're talking about.
Yep.
So thank you so much, Paul, for coming on. Is there any upcoming events or anything that you would like to plug while we're here?
No, I think I'm good. Thank you.
Okay.
I really appreciate the time, and I really appreciate getting the firefighter perspective on this thing out to the folks. Thank you.
Great. Well, as always, this has been another segment of Labor Vision talking about ARPA spending. You can like and follow us on all social media platforms, subscribe on YouTube, and check out our website, laborvisionri.org. And as well, you can see a full list of the labor recommendations for ARPA spending on the AFL website and linked below in the show notes. So thank you.
Thank you, Autumn. Have a good day.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.